Hi, this is Dr. Lori Bagai from Orange, California. I am a general dentist here. We are a full service dental office, and we do get asked a lot of questions about periodontal disease. So I'm going to answer those for you today. So the diseases associated with a periodontist are, as simple as gingivitis or periodontitis or advanced periodontitis, gum recession, tooth mobility. All of these fall under field of periodontics. Periodontics is anything that has to do with the supporting structures of a tooth. So the bone or the gum that the tooth sits in, that's what deals with the periodontal disease. So it's anything but the tooth. So periodontal disease just starts always initially with a little bit of gum swelling, a little bit of bleeding, when you brush your teeth and you spit out, your spit might be stained a little bit with blood. And normally, most people think it's common for the gums to bleed, and it usually gets ignored. And then it starts to go deeper into your gums when it becomes periodontal disease. And once it gets deeper into your gum, it's very close to the bone. And then the bone gets diseased, and the bone supports the tooth. So once the bone and the deeper gums get diseased, the tooth starts to get mobile. And once the tooth starts to get mobile, eventually it leads to tooth loss. Yeah, that's a very good question. So I get told a lot of times by patients that, my grandfather or my mother has bad gums. So I'm, of course, going to have bad gums, right? In a way, it's right. But, if I have, thinning hair in my family. Since I'm very young, I can look after my hair better, not treat it too much, with color or dye or perm it or straighten it, just so that I can hang on to my hair better since I'm very young. So similarly, as far as gum disease is concerned, if I know that gum disease runs in my family, I should be very careful about my gums, make sure that I take care of it from the very beginning. Make sure I brush twice a day, floss regularly, go to the dentist regularly, make sure I get checked out regularly. So that's kind of what we need to do if we know that, teeth or gum issues run in our family. Wow, that's a really good question. So the newest research shows gum disease and periodontal disease and heart disease are connected. So all disease starts from germ, and we actually introduce the germs in our body ourselves. How? Because we are eating food all the time. Now our food is not sterile, it is clean, but it does have germs in it. And, other activities that we do with our family, kissing or anything else that, we might be doing, personal body-to-body contact with spouses or boyfriends or girlfriends or anything like that, all of them introduces germs in our body. Now, obviously, we are swallowing those germs and it enters our bloodstream eventually. Once it enters our bloodstream, it goes into our heart or our lungs or our intestines or whatever. And sometimes it gets stuck on, heart valves or, on our kidneys or our intestines, and it can cause a disease process. So when it goes into our heart, it can actually cause inflammation of the heart or heart disease. And latest research shows that a lot of heart diseases, believe it or not, starts from gum disease. That's a very great question. Diet for periodontal disease, a good diet for periodontal disease. You want to eat more natural foods. I'm sure your dietitian tells you the same thing, fruits and vegetables and less refined diet. And, something that is a little bit stronger for your teeth to chew on. Now, I'm not talking hard stuff, but apples or, pears or oranges and things like that. Nothing in excess, like you don't want to do too much citrus, too much lemon juice, too many oranges, Just a normal, healthy diet is good for the teeth and gums as well. To treat periodontal disease, dentist, starts out with taking your x-rays normally. measuring your gum pockets, those are pockets around the teeth that show us how far your gum has gotten destroyed. And then depending on what the findings are, if it's just mild inflammation or moderate inflammation, which is called gingivitis, then we would probably just do a regular cleaning. Now, if the infection has gone deeper into your gums and it's all close to your bone and you have, deposits under your bone, or you have disease under your gums and bone, then that needs a deep cleaning. Sometimes that might also need more intensive treatment with antibiotics or laser treatment, or if it's very advanced, then it might need certain surgical procedures as well. To treat periodontitis at home is actually pretty hard. Gingivitis to a certain extent can be treated at home, which is the milder form of gum disease. So, you might be able to get out of gingivitis by brushing and flossing your teeth. But once it becomes periodontitis or it's under the gums, you have to go to the dentist to get it treated. You cannot treat it yourself. And if it's even deeper, then you'll have to see the surgeon. But the first, single most important thing is to go to the dentist. Even if you're not having any problems with your gums, you should go to the dentist because it prevents gum disease. So let's just get started with seeing the dentist. Well, the best time to schedule a dental appointment is right now. You should have scheduled the appointment like 20 years ago, but of course the time has passed. So let's do it right now. Let's pick up the phone and call 714-744-1242 for the best dentist out there.